Hi guys, happy week 16. I cannot believe we already finished. This is our last assignment and I'm incredibly excited to be graduating in a year. But back to business, I decided to do the tool critique on the mood disorder questionnaire, and I think since I did the last, Dr. Pila's project on bipolar disorder, I was interested in finding a potential bipolar disorder screener, and the mood disorder questionnaire was one that came up. And so briefly about it, it is a self-report instrument that can be used to identify the presence of bipolar symptoms. And the creator of the tool emphasizes that it is not a tool that should be considered like a replacement of a medical evaluation or accurate, thorough diagnosis of bipolar disorders, bipolar or related disorders. So it is most useful in clinical settings with adults, and based on like my past research on bipolar and research I've done regarding this specific questionnaire, when patients come into doctors' offices presenting with symptoms of depression, they're often misdiagnosed with depressive disorders, and so bipolar or related disorders are kind of underdiagnosed. So this is a screener that's supposed to kind of help with that and spotting bipolar in people who not only are experiencing depressive episodes, but can be experiencing mania or hypomania. So I kind of, put my thinking cap on and thought this could be obviously helpful for therapists, but general care practitioners. And I was also thinking a gynecologist too, like when women go in for like an appointment and they're experiencing mood changes, I thought, well, this would be a pretty good screener to see like if their mood changes are related to PMS or if there's something more beyond that. So that was one of my thoughts. And unfortunately, this tool is not it doesn't give me great confidence, unfortunately. The research shows that it does have strong validity, but it has poor reliability, mainly because it does not detect the presence of bipolar in individuals who have no previous diagnosis of bipolar. And I was like, did I read that right? I did. It detects the presence of bipolar related symptoms in people who have a history of bipolar. It does not do a good job at detecting like the initial presence of bipolar in people who have no past history. So that kind of raises I'm going to get into one of my weaknesses, but that raises the question of, what's the purpose if it's not reliable in the results that it gives us. And it also does not provide consistent results across various forms of bipolar. So like people's presenting symptoms in bipolar 1, 2, and cyclothymia is not, like the tool is not sensitive enough for measuring the differences between the disorders. Which is unfortunate. To score the tool, it's 17 questions. It's broken into 5 sections. Section 1 is 13 yes or no questions. And then if the individual answers yes to 7 or more of the questions in section 1, and they answer yes to the question in section 2, and they answer moderate or serious in the question of section 3, then the scores are well, the person administering the assessment is basically like further medical assessment for bipolar disorder is warranted. And so what I get from that is it can detect the presence of potential bipolar or related symptoms, but it is basically like, well, yeah, if they answer enough of these questions, they should probably seek some medical attention or professional attention. So a strength that I found, or like that initially drew me to this tool, is that it is accessible and it's a non-invasive way to screen for bipolar. I think that bipolar and related disorders are very stigmatized. Like, I don't know, I feel like I've talked about this a lot, where in the media, people with bipolar are like, oh my gosh, they're crazy. She's just bipolar, you know? And so I think like administering a screener can kind of intimidate people and maybe cause them to not provide accurate answers. And so I like that this screener was short and maybe not completely obvious of what it's screening for. And it's definitely easy to score for the provider, which leads me to believe that there is a large chance that because it's accessible, because it's easy to complete, it takes like 5 minutes, it's self-reported, that maybe people would administer it more and therefore catch bipolar disorder earlier and therefore get people treatment sooner. But unfortunately, the weaknesses do overpower the strengths of this tool. I think that this tool loses a lot of its value because it is not completely reliable. I really don't understand what the purpose is if it can't detect bipolar disorder in people with no previous diagnosis. And another large downfall of this tool is that it does not include a systemic perspective. People with bipolar are not exactly a reliable source of information for their symptoms, especially when they're experiencing like mania or they're in a depressive episode. They probably don't like understand the full consequences of their behaviors and their symptoms. And so giving a self-report assessment is very limiting, and the experiences and the perspectives of family members is really valuable, especially as we are systemic thinkers. So from a Christian worldview, I decided to look at this from like the pathologizing, non-pathologizing perspective. I think it's most relevant when it comes to diagnosing people. I have formulated more of a strength-based approach, and with that, I kind of don't see like the incredible relevance of a diagnosis, but then again, I do. So I kind of was back and forth on this. I could see how using an assessment like this questionnaire would be helpful because pathologizing a person's experience can be very freeing and a great explanation for things that people are experiencing, especially when we don't understand why we're experiencing things. How many times can I say experience, right? When we don't know what we're experiencing, it becomes scarier. And so pathologizing does help, and like, hey, this isn't a book. You are not the only person to experience this. We'll be okay. There's like people who work on this, you know? There's help out there. And I think viewing pathology from a Christian perspective might say that, yeah, mental disorders are a result of sin and the fall of man. And I don't know, I might be naive, but I think that God would would be okay with me saying, hey, this person has bipolar disorder and it needs support. But I also can see how non-pathologizing is important, and reducing shame or guilt, because people are more than what they are experiencing because of sin or trauma. So in general, I really wish that this, like, the validity and reliability of this tool was better, but I think it would just be generally useful in highlighting the potential risks or the potential presence of bipolar or related disorders, just because it is such a underdiagnosed disorder that this tool helps us take one step closer to diagnosing the right people and helping them get the treatment that they need to live a better life. So yeah, those are my thoughts. Thank you so much for listening. Enjoy Christmas.